Good morning, everybody, and a warm welcome to the inaugural function of the RSSDI campaign on Save the Feet, Keep Walking. We are extremely proud and privileged to have you with us. And this is a campaign that we've been looking forward to initiate, knowing the fact that people with diabetes tend to get often feet related problems, which often get missed out, not tested, or patients tend to get, they tend to ignore their problem landing up with disfigurements of feet or foot amputations leading to poor quality of life. All this is potentially avoidable. We know that if measures are taken early enough, we will be able to save feet, which obviously is going to go a long way to keep people healthy and improve their overall quality. Now, we did a campaign last year, Defeat Diabetes, and encouraged with the success of the Defeat Diabetes program, we decided from the RSSDI that this year our focus should be on the feet. And we are very nice and proud, and we are happy that Dr. Vijay Vishwanathan agreed to lead the program. The entire executive committee has been involved. Dr. Amit Gupta has been coordinating the entire program. And we look forward to a month-long campaign where the focus is going to be on, making people aware about foot problems and diabetes, testing, testing, and testing. That's been our motto that every patient who comes to the clinic should be screened for foot-related problems, and they should be taught how to, look at their feet. And having said that, if we do find feet at risk, then early action should be initiated to protect the feet from further progression of any problem. Having said this, we look forward to it that in the next 1 month, we will reach out to maximum number of population locally and at distance. We from the RSSGI will always be there to assist you. And whatever help you need from our side, we will be always there to reach out. We're also thankful to USV, Farida, and her team, who's been very kind enough to lend support to this meeting. They have been instrumental in giving us all the backend support for the meeting. So thank you very much, USV and Farida, for making this campaign a success. And next 1 month, we will be initiating a lot of measures. Look forward to interacting with you all the time. And without much, they should be taught how to handle this back to Amit for taking the proceedings further.
Thank you, Dr. Sanjay Agarwal, sir, for this very, very novel initiative and for welcoming all the RSSDI members and all the dignitaries and the guests who have joined us for this inaugural function. And special thanks to Dr. Vinu, who is the president of International Association of Diabetic Foot Surgeon. He has already joined us. So now I would like to hand it over to Dr. We would like to go for Saraswati Vandana first. And I will request the RX team to play the Saraswati Vandana.
वक्रतुण्ड महाकाय सूर्यकोटि समप्रभ निर्विघ्नं कुरु मे देव सर्वकार्येषु सर्वदा.
As before any big moment in our life, we always pray to the God to give us the strength and to move forward, to move ahead, and to execute the things as we think of and with the perfection. The Save the Feet campaign by the RSSDI and Keep Walking campaign is a very, very novel initiative. It has not been attempted anywhere before. And as Dr. Sanjay Agarwal has highlighted, the entire objective of the campaign is built in such a way that we want to sensitize both the general public, the patients, their caregivers, as well as the healthcare providers regarding the importance of the foot. So without wasting time, I would like to invite Dr. Vijay Vishwanathan, sir. Dr. Vijay Vishwanathan, sir, is currently the Vice President of the RSSDI. He is also leading this campaign and he has spent almost 6 to 9 months for designing this campaign. And sir is also currently the president of the DFoot International the society, which is one of the major societies when it comes to foot care globally. So I would like to welcome Dr. Vijay Vishwanathan, sir. So please go ahead and tell us more about the campaign and your views about this.
Thank you, Amit. I'll take only about 1 minute or 2 minutes to talk. I would like to first of all welcome Dr. Vinod Kumar sir, who's one of the senior most members in our RSSDI. I'd like to welcome Dr. Venu Kavartapu, who is one of the most brilliant diabetic foot surgeons in the world, and he heads the International Association of Diabetic Foot Surgeons. The DFoot and the IADFS are collaborating, and we are collaborators. And I would like to welcome Dr. Venu Kavartapu, who's a very busy surgeon in London working with Mike Edmonds. And today he, at a very short notice of just 2 days, he decided to join us. And so welcome, Venu, for this meeting. I'd like to welcome all the respected RSDA members, the president, president-elect, past president, for joining. I think it's a historic moment for RSSDI to launch this campaign. After practicing as a diabetologist for 31 years, I think I'm quite convinced that one of the most neglected complications of diabetes is the diabetic foot complication. So I think this is a right time to start a campaign on save the feet and keep walking. And we would be screening, we are very ambitious. We intend to screen 100,000 people with diabetes in 1 month. And I would like to particularly thank the president-elect, immediate past president, the Diabetic Foot Task Force members, and Amit Gupta and his team, Sanjay Agarwal, the secretary, and his brilliant secretariat for working for the past so many months to put this into place. So with these few words, Amit, you can give the details on how the campaign will go on. Thank you.
Thank you, sir. With this, sir, everyone here about the campaign. The campaign is today we are having the inaugural function, and from starting tomorrow and for the next 1 month, what we inviting all the RSSDI members, all the members of the physician community, and anybody who is involved in care of diabetes and the people with diabetes. We want them to be involved in this campaign, and for entire 1 month, we are going to screen the foot. For screening the foot, we have designed a very simple form, which is based on 3 important components of the campaign. We are going to take a brief history. We are also going to do a physical examination where inspection and the palpation of the pulses is there. But the key component of the program is the monofilament, which we are going to use. The monofilament we are going to use for the screening of the LOPS. And we have designed a very good portal, and all the information is available on the website of the RSSDI. So we can visit our website, rssdi.in. If the Mayank is there, then I would like to ask Mayank to share the screen so that Mayank can show us the video which we have created to show how to examine the foot. And we have kept it very simple. We have divided into 2 parts. One is the clinical, the history taking part, and the second is the part where we are doing to test the pulses, and third is the part where we are going to use the monofilament. So for this campaign, the monofilament is the instrument which we are going to use for the LOPS. We would like to request all the RSSDI members to participate in this campaign in a big way. We are going to supply them with the monofilament so that they can use the monofilaments for testing the patients. As guided by the task force and Dr. Vijay Vishwanathan sir, a single monofilament we can use in 10 patients in a single day. Because otherwise it loses tensile strength, and a single monofilament can be used in up to 70 patients without any issues. Also, we are going to have simultaneously many programs on the social media on the RSSDI Diabetes Bites, where we are going to create the awareness regarding the foot and its complications. Also, this year the RSSDI district coordinator CMEs, which we held which are being held in every district. The main focus and the theme area is to have the foot is the focus. So the CMEs will also be talking about the foot only. So we have this. We will show you the video which we have created in a short while. But now I would like to invite the task force members of the diabetes RSSDI Diabetic Foot Task Force. And with that, I think we have Dr. Sharad Pandse, Dr. Rakesh Sahai, and welcome Dr. Ghanshyam Goyal. We have Dr. Ashok Damir, and we have Dr. Sujit also with us. So we will request all the members of the RSSDI Diabetic Foot Task Force to say their words of wisdom in this inaugural function.
Thank
I
you,
can
Amit.
see.
Yeah.
Yes.
Thank
Please
you,
go ahead,
Amit.
sir.
Probably, I think this is going to be the world's largest screening program for the diabetic foot. So, all the great success and under the guidance of Dr. Vijay Vishwanathan, I think we are able to reach our target of 1 lakh patients screening, and probably that is going to go in long way and is going to help patients and the physicians who are going to screen, and it will be a habit for all our physicians or diabetologists to screen all the patients of diabetes for diabetic foot. Thank you. Amit, you are muted.
Rakesh Sahai?
Yeah.
Yes, sir.
So good afternoon to all. Thanks for inviting me here, and I would like to congratulate Dr. Vijay Vishwanathan, the chairman of the Foot Task Force, for initiating this project, which is a very unique and probably is going to be the largest such a campaign in the whole world. And as he has highlighted rightly, that the foot is the most neglected part of diabetes management, and this campaign is designed to put the feet first, and that's how it is going to make a change. And I'm sure this campaign will make a huge impact in terms of improving the awareness of foot care across the country, and I'm sure this is going to result in a significant improvement and reduction in the rates of amputations that we're going to see in the coming years. So, I wish all the best to all the members of RSSDI, and I would request all the members of RSSDI across the country to take up this campaign wholeheartedly and make it a very successful campaign.
Pratap Jatwani is a member of the task force. Pratap? Okay, Pratap is not there. So, Amit, on to you.
Sir, we have with us Dr. Shashank Joshi, sir.
Oh,
He's
yes.
the past president of RSSDI. And we also have Dr. Vinod Kumar, sir, with us. So I will request Dr. Shashank Joshi, sir, to say a few words about this campaign, and we will seek his blessings.
So thank you, Amit. First of all, I must congratulate the entire RSSDI, particularly Dr. Vijay Vishwanathan, who has led the world in diabetic foot. And Vijay, congratulations to you and your team. You have been simply outstanding. We have been following you in diabetic foot for the last 30 years, and you have spent your lifetime in this. So congratulations to you. And I congratulate Dr. Vasant Kumar and the entire team, Dr. Makkad, and particularly people like Amit, who are the brand next and Jan next of RSSDI, who are taking RSSDI to the next level under stewardship of Bansi. And I think, you all are reaching the masses. And saving feet is a very important target. And I wish RSSDI team Diabetic Save Feet under the stewardship of Vijay, ably guided by Dr. Vasant Kumar and Dr. Bansi and Dr. Makkad. Best wishes. We are all committed from behalf of IDF for a single goal, single purpose. We are all here for the people living with diabetes, and we want to make them complication free. And this is one such endeavor. So congratulations once again to all of you. And my best wishes. We are always there with you 24/7, 365 days. We are all committed to for people living with diabetes. Thank you and Jai Hind.
Thank you, Shashank.
Thank you, sir. I will now request our patron, Dr. Vinod Kumar, sir, to give his blessings and guidance for the campaign.
Thank you, Amit. Well, I think it is a very laudable objective, and I congratulate RSSDI for undertaking the same. The special thanks are to Dr. Vijay Vishwanathan, who is the pioneer in this field. And the objective of screening 100,000 people in next 1 month is also very praiseworthy. And I'm sure while screening, necessary education about the foot care, its cleanliness, about the nails and everything will be provided to the prospective screening subject, and also about the footwear and so on. That I think you know so much about it. And finally, I like the theme, save the foot, keep walking. So I think this takes into account many other aspects of diabetes care. So this theme is very lovely to me. Thank you very much for inviting me.
Thank you, sir. Amit?
Yes, sir. So we also have Farida ji from USV, and this campaign is very well supported by USV. And so I will request Farida ji to say a few words here.
Yeah, at the outset, I must congratulate the entire RSSDI team under the leadership of Dr. Vasant Kumar, Dr. Vijay Vishwanathan, led it by Dr. Amit and Dr. Sanjay Agarwal to have kind of, unleashed this particular very needed campaign. And as we are committed to ensuring that diabetes is not recognized as a capital, but as a diabetes care capital of the world. So we are committed to it. And thank you so much for, making us your partner in this endeavor. And we will do our best to make sure that the goals that we have set together will be achieved in this month. Thank you so much. All the best to you.
We really appreciate your support because we would like to reach as many doctors as possible to spread the message. And I think with your support, we will be able to achieve the goal what we have set for this particular campaign. I would also like to share that I have the privilege of sharing the screen with our president, Dr. Vasant Kumar sir. We are sitting in the same room and sharing the same laptop. So you may not be seeing. So I would just like to say that welcome him. He is with us only, and he is sharing the same screen.
Thank you, Amit.
Yes. And now with this, now I would like to invite our president-elect, Dr. B.M. Makkad sir. Dr. B.M. Makkad sir is the president-elect of RSSDI, and he has played a very instrumental role in conceiving this program, along with the other, our president, past president, and the other EC members. So I will request Makkad sir to say, to guide us about this campaign. Sir, unmute yourself, sir.
Hello.
You are audible now, sir.
Good afternoon, everyone. At the outset, I'm thankful for, thankful to Amit and team, sorry. Hello. Can you hear me?
Yeah, we can.
Okay. So it's great that we are doing a lot of activities at RSSDI level, and this is one of the major campaigns which has been conceived under the guidance of Dr. Vijay Vishwanathan, and being very ably, executed by our team of people, and people like Amit are actually leading from the front. So it is always great to see, team working very well. I am sure this is going to be a very good initiative, and foot is one of the most neglected areas. Most of the time it is not examined even in the clinic. So I think campaign like this is going to be very important. So I'm sure we will be able to achieve our goals that we have set, and be able to create a lot of awareness and detect a lot of undetected foot issues during this campaign. So all the best to team, and all the best for the campaign. Thank you.
Thank you, Dr. B.M. Makkad sir. Last year, we actually did a campaign called Defeat Diabetes. And Defeat Diabetes, if you all remember that in 100 days, we were able to reach more than 100 million people. And this was one of the very successful campaign of the RSSDI. And it was also registered with the Asia Book of Records. Also, in one single day, we tested more than 1 million people, and we screened them for diabetes. And also the few of the data has been presented as the ADA also. So now I would like to invite Dr. Bansi Sabu, who is the immediate past president of the RSSDI. and he is currently also we know him. He's a very thought leader. He guides us. He's mentor to many of us. So we'll request Dr. Bansi Sahu sir to give his blessings for the campaign.
Amit, first of all, thanks. Thanks for your kind words. But I'm the part of RSSDA. Whatever I have done, it is to be done. And this campaign, which is very, very ambitious campaign, which we have taken to save the fit, because it is a very neglected problem, not only from patient point of view or caregiver, it is also neglected from a physician point of view. And this campaign, which we are starting under RSSDI, under leadership of our president, Dr. Vasant Kumar, with very able secretary, Dr. Sanjay, led with our vice president, Dr. Vijay Vishwanathan, who is a senior diabetologist and diabetic food specialist, who is also president of D Food International, and our president-elect, Dr. Pakkad. I'm sure this is going to motivate and educate our patients as well as our caregiver and physicians across the country. They should understand more about the importance of fit problem, diabetic foot problem. They will also try to examine, and we are going to create a record in our country. In a week time, we are going to have more than 100,000 fit examined, and it is USV. So I'm sure we will able to do it. Similarly, what we have done a defeat diabetes campaign, at least it had created a awareness campaign across the country, and people started understanding the importance of that how sugar monitoring should be done even for asymptomatic people. And we have detected thousands of people who were not having any symptoms and they were newly diagnosed diabetes. And similarly, this is also going to create awareness those who does not have any complaint related to diabetic foot, but still they will find that there are a lot of issues in their in their fit. So this campaign is going to be very, very successful, and it will also create for other countries to follow us. Like Dr. Vijay is also a president of D Food International. We are going to have with us IDF President International Diabetic Federation, Dr. Andrew Bolton, who is also a diabetic food specialist. So I'm sure now other countries will also follow us on this sort of awareness campaign. We know that diabetes leads to multiple complications, but this is one of the most neglected complication of diabetes, because everything we are talking of cardiorenal complication. In last 10 years, we talked about preventing cardiorenal complication, but we have completely forgotten that a foot complication can be prevented, or at least the amputation can be prevented if we teach and educate our primary care physician. So with this, best wishes to all RSSDA member, RSSDA Secretariat, and everyone who is involved in this RSSDA project, particularly Dr. Vijay and Amit, and plus our President and Secretary, Dr. Vasant Kumar and Sanjay. With this, thank you very much for inviting me and involving me in this way. Thank you.
Thank you, Dr. Bansi sir. Yesterday, I had the privilege to listen to the first Paul Wilson brand oration, which was conferred upon Dr. Andrew Bolton during the meeting of the D Food International. And it was really an eye-opener, and it was very good to learn that Mr. Wilson happened to be from India only. He was born in Chennai. So Dr. Andrew made a special mention yesterday that the journey of the diabetic foot actually starts from India itself. So he mentioned India many a times during his oration, and I think a lot of things have developed in India only when it comes to management of the diabetic foot. So with these words, I would like to welcome our President, Dr. Vasant Kumar, who is sitting with me. And Dr. Vasant Kumar has guided us in many campaigns. This is one of the campaigns which we are going to launch. He has also guided us for the 100 Village NCD project, which he has undertaken with the Rotary also. So I will request our President, Dr. Vasant Kumar sir, to say a few words.
Thank you, Amit. It's wonderful to see all our dedicated colleagues for this inaugural function of a very important, yet another important campaign by RSSDI. And we feel so happy that we are able to do this campaign. And of course, all of us are grateful to the task force members, which was very ably led by our Vice President, Dr. Vijay Vishwanathan. I also thank Dr. Venu for being with us, representing an international organization. All of our colleagues have told us the importance of this very important, very unique campaign. And I must say a moment which we'll take up in this month. So two things are going to happen. One is we are actually going to examine the feet of more than 1 lakh people all over India. Second thing is we are creating an awareness to people with diabetes. We are also creating awareness to our doctors who manage diabetes, and take this forward subsequently over the next months and years, and see that our people with diabetes will come out of this dreaded complication and they live a better, healthy life and an active life without many issues. And it's going to be a continuous process, I can assure you, my friends. I thank all of you for being kind and being with us. And I thank my friend Amit, and I'm going to wish all the best to all the participants and all the doctors who are going to participate. Thank you, Amit.
Thank you, Vasant Kumar sir. Now I will request Dr. Vijay sir to welcome our guest of honor, Dr. Venu, and
So it's my,
Dr. Vijay sir, please.
It's my proud privilege to introduce Dr. Venu Kavartapu, who is a brilliant surgeon, especially of the Shako foot. He works in King's College along with Mike Edmonds and Nina Petrova and her colleagues and his colleagues. And he has saved many limbs from amputation, especially Shako foot. And he's currently the president of the International Association of Diabetic Foot Surgeons, IADFS. And I'm very happy to say that DFoot International and IADFS have signed an MOU, and we are working together. And Venu is the current president, and he's doing wonderful work in London. Venu, thanks for once again accepting within 2 days of requesting you. Thank you, Venu, and for rescheduling your surgeries in London today. Venu.
Thank you. Thank you very much, Vijay. And greetings from London to you all. It's really inspiring listening to all your talks. On behalf of the International Association of Diabetic Foot Surgeons, we would like to send a warm congratulations and best wishes to this amazing and actually such an inspiring campaign to improve the lives and quality of lives of patients suffering from diabetes in India. And listening to your views and talks on this campaign is really inspiring for all of us. We know that over the past perhaps 3 or 4 decades, we have seen a progressive improvement in the care of diabetic foot presentations, whether in the primary prevention area or management of early trivial lesions or medical management, wound care, or even end-stage diabetic foot surgical management, which I have witnessed a massive improvement over the past decade on perhaps the surgical management of infected Charcot foot or end-stage vascular compromise or extremely severe diabetic foot attack as well. So it's really pleasing to see amazing improvements in all those areas. But however, the best way we can help the patients in large masses is by doing what you are actually proposing to do in this campaign, which is amazing. Going through 100,000 patients in assessing for peripheral neuropathy, and that campaign raising the awareness will perhaps help many, many millions of patients worldwide. So I'm really excited to be involved and informed about this. And IADFS, the International Association of Diabetic Foot Surgeons, will be very happy to contribute in any way for this amazing work. So my personal congratulations to RSSSDA again, and key members within your group. So many of you, current president, Dr. Vasant Kumar, Bhanshi Sashu, immediate past president, Mr. Dr. Makkar, Sanjay Agarwal, Dr. Amit Gupta, and many, many of you. So warm wishes again from us. And I'm pretty sure that this will benefit millions globally. Thank you.
Thank you, Venu. And thank you for your kind words. And RSSDA has also signed an MOU with DFoot International. And I think we can think of signing an MOU with IADFS too.
Of course.
So we will discuss with our president and secretary and get back to you. We have signed an MOU with DFOOT some time ago.
Perfect. We all share common goals.
Thank you. And Amit, you can take it.
Congratulations, Vijay, for that excellent work. And I have to specially thank Dr. Venu on behalf of our society for spending the time, for encouraging us. And we look forward to work together in the coming years, not only in India, but in the rest of the world. Thank you so much for being with us. Hand over to Amit.
Thank you, Dr. Venu, and I am sure your words of guidance and encouragement are going to help us through this campaign. And the suggestion given by Dr. Vijay Vishwanathan sir will definitely be looked upon by our president, Dr. Vasant Kumar. And now I would request Mayank to play the video of the foot examination, which has been specially created for this campaign. So Mayank, will you please?
Amit, we first have the Professor Andrew Bolton's.
Okay, sir. So, Meg, please first play the video of our chief guest. We would like, and I will request Dr. Vijay Vishwanathan sir to introduce our chief guest, and then we will play the video of Dr. Andrew Bolton.
Yeah, Professor Andrew Bolton had agreed to join, but last minute there was some other program, and he recorded a talk. He's going to come to Delhi for the Golden Jubilee celebration next month. So Professor Andrew Bolton is the president of the International Diabetes Federation, and he has contributed about 40 years of research and clinical work in diabetic foot. And he currently works in Miami and in Manchester. And many other things we know today in diabetic foot, like the biothiometer, the foot examination, the monofilament testing, are all his studies. And he and Mike Edmonds are the two people who have led the world in our knowledge on diabetic foot. Of course, Paul Brand worked on leprosy, but these two gentlemen worked in diabetic foot, Mike Edmonds and Andrew Bolton. So Andrew could not join us, but he's recorded a 30-second interview yesterday. So can you just play it, Mayank?
From the United Kingdom, where it's actually reasonably warm at the moment, but for you it would be very cold. It's a pleasure and an honor to be the chief guest at the inauguration of this wonderful plan of the RSSDI. And first of all, might I congratulate the RSSDI on 50 years of existence this month. I've had the honor and pleasure of speaking at several of your meetings, and I know the great interest in diabetes that is shown right across India, from the north to the far south. And this year, you've chosen a project to save the diabetic foot, keep walking. And I couldn't be happier, obviously, because this has been my aim for the last 40 years. I've been working or more in the diabetic foot. And you have, of course, 21 state chapters and plan to screen 100,000 people with diabetes for foot problems. And knowing India, I'm sure you'll do many more than that, because everybody's so enthusiastic. And the key thing that we learned from Dr. Paul Brand, and I've had the honor of giving the Paul Brand oration yesterday of the Diabetic Foot International. The great thing about Paul Brand, he said, you do not need expensive equipment to diagnose the high-risk foot in diabetes. You just need good clinical practice. When he was asked to speak to the American College of Physicians many years ago, a surgeon asked him, what's the most important thing we can do to reduce amputations in America? Of course, they were expecting, being in the United States, some expensive new scan. Brand said, the most important thing you can do to reduce amputations in diabetes, every time you see somebody with diabetes, remove their shoes and socks and examine the foot. And if you achieve this alone in 100,000 people, this will be a huge step forward in screening. But not only do we need to screen, we need, in those who we identify to be at high risk, to have some intervention in terms of education. And as we've just been talking about yesterday, about smart technology coming in to help us identify the foot before it breaks down, perhaps because of high temperatures or high pressures. So there's much to be done. I congratulate the RSSDI and wish them a happy 50th birthday this month. And indeed, I hope to be in Delhi next month to actually be present at the 50th anniversary, which is a huge feat of achievement. It's a huge achievement, and I know how active your society is. I congratulate you, and most of all, I wish you a happy year, saving feet and keeping walking. Dhanyavad. Thank you very much.
Amit,
Yes. So this was the message which have been sent to us in the form of blessing by Dr. Andrew Bolton, and he will personally be present during the 50th year celebration of RSSDI in New Delhi on 14th of August. Now I will request Dr. Sanjay Agarwal to just show us the website which has been specifically created for this campaign. What is the registration process? How we are going to record the data? And then he will also show us the video which has been specifically recorded for this campaign. Over to you, sir.
Thank you very much, Amit. Can you share the screen, please?
Yes, sir.
So for registration, you can go to our website at the rssdi.in, and you can see there's a very simple registration process that you have there. The form just needs a couple of fields to be entered. Can you scroll it, ma'am? Yes, great. So you just have to do this registration process once, and once you do that, you're part of the entire campaign. And then henceforth, once you start enrolling patients, you'll be able to just get into the platform, and then you can see all the patients enrolled by you on this platform. I'll just show you how we're going to record the data. It's a very simplified process, and man could just keep typing out one typical form. So you just need to enter the city that the patient is. Man, can you keep typing it so that you can, and then you enter the age of the patient. We're keeping it anonymized so they don't have identity of the patient, and then you just put in the demographics of the patient, gender, then you can decide the type. It's just a drop down, type 1, type 2, or others. Then we just want duration of the diabetes to be captured. So it's less than a year, 1 to 5, 5 to 10, or more than 10 years. Then you just need to put the last A1C the patient has measured in the last 3 months. And if it is tested, you can put the value down. If it doesn't have the value, then you can leave that blank. And then you can either document the random blood sugar, fasting, or the post meal, depending on the time of the day the patient comes to you, or if he has got a recent report with him. Now that's based on the simple findings that the patient has got. Now on the examination front, we've kept it very simple. Does the patient have any foot ulcer? Yes or no? You identify one of it. Does the patient have any lower limb amputation or surgery? Then has the patient undergone any kind of an intervention, vascular intervention? So you can put that down, yes or no. Does the patient have any, complications as known to him? So whether this patient has got a renal complication or a written complication, and we have kept one field that is not tested. So if the patient is not looked at for complications, you can just put not tested. Is the patient smoker or not? So you can put that down. And if it is yes, then what is the volume of smoking that the patient does? So if he's an ex-smoker or smoker, that you can put that down, right? Then does the patient have any symptoms of neuropathy? Does the patient have any claudication pain or other breast pain that the patient has got? Are there any changes in the skin color or skin lesions? And what is the patient experiencing any loss of sensation in the leg or the foot? So it's very simple. All you need to do is yes or no. And then on an examination, does the patient have any discolored, ingrowing, or elongated nails? Is there evidence of any fungal infection in between the toes, that's in the web spaces? Does the patient have any discolored or hypertrophic skin lesions, calluses, or corns? Does the patient have any open wound or heel fissures? And is there any warm, swelling, or redness in the foot suggestive of any cellular? Now, the neurologic examination will be for all registered participants. Will be providing monofilaments, and representatives of the USP will meet you to provide you supplies. And all you need to do is just 3 points examination. That's A, B, and C, as you can see out there. And you can just mark it as presence or absence, and the way it is to be tested. This will be followed by a video that we have created as to how to examine. We are just doing the monofilament 3-point test because that has got a sensitivity and very high sensitivity and specificity, and that is good enough for looking at presence of loss of feet at risk as such. So you just mark this out in both the feet, and then you come to the musculoskeletal. Does the patient have any obvious deformities, and how long the patient has had? And then you just look at the vascularity. So is the hair growth on the dorsum or the lower limb decreased? Are the dorsal pedis and posterior tibials palpable? Is the temperature cold, warm, or normal? And if possible, if you want to upload any image of the patient's foot, then we have kept that option open as to, you can take a photograph and upload the photograph of the patient, so that at the end of the day, we will be able to create a library of photographs of different, foot problems that the patient comes to us. And that will be very good to have a, collection of photographs, which we can use it for teaching purposes. Now, once you have entered all this, all you need to do is submit the form, and it comes to the database at the back end. This is going to help us to create a lot of statistical analysis as to how our patients are in the country. And this will also help us to develop a risk profile score, which we can use to then, say that which are patients at low risk, medium risk, and high risk, and which are the patients that we need to concentrate on. And perhaps this will help to generate our own India-specific data. After we finish this campaign, perhaps, as Vijay was telling me, we will perhaps have the largest database in the world on the incidence of foot problems in our country and what kind of foot problems that we experience. I'm sure the statistical analysis that will come out of this entire campaign will be very interesting to watch, and it will help us to frame guidelines for the future. So with this, I just want to stop share, and I want Mayam to show us the video, which very nicely Vijay has created for us for learning purposes. So Mayam, can you please share the video? So there are two videos. One, identifying the need of testing foot problem, and second is how to do the monofilament testing. So this is the first video telling us about the need for.
Now we come to an important part,
examination.
and that is examination with the monofilament testing for detecting what is called loss of protective sensation, or LOPS. Now I will show how we test with the monofilament. This is the monofilament. We test it here, here, here on the right foot, and here, here, here on the left foot. It was very important to apply the monofilament perpendicularly, like this. And the very important point is you should allow it to buckle only for 2 seconds. You should keep it, make it buckle and remove. You should not keep it there for more than 2 seconds. So you test here, and test here 3 times. And once you should do it with the monofilament. One is a mock test where you don't apply the monofilament. Third time you apply the monofilament again. So 3 times in each area which you see here. So totally there are 6 areas. It is very important to also make the patient close his eyes before you start doing. You can also make the person feel the monofilament somewhere in the upper arm if you want to, and then start doing it. So the RSSDI Save the Feet and Keep Walking campaign of 2022 is what I told you just now. Just ask a few questions and examine with the monofilament as I showed you. And this would constitute the Save the Feet and Keep Walking campaign. The main purpose is to detect people with high-risk feet or at-risk feet so that you can prevent an amputation, lower limb amputation, and a diabetic foot ulcer in such people. Thank you for your attention.
Thank you. We have another video, of course, which just talks about the importance of testing feet. And I'm sure this entire data collection will be very helpful for us. We want to structure this data, yes. Can you play the second video also?
This short video has been specifically made for the RSSDI Save the Feet and Keep Walking campaign 2022. Now, in people with diabetes, to prevent a diabetic foot ulcer or a lower limb amputation, it takes only a few minutes to ask a few questions. and also do a simple foot examination, which I'll show you. And this is to identify people with at-risk feet or high-risk feet. As a first step, begin asking whether the person with diabetes has had a past history of diabetic foot ulcer or an amputation of the toes or of the lower limb. Second is, ask the person with diabetes whether he or she has symptoms of neuropathy like burning sensation in the feet, tingling, numbness in the feet, and so on. And then you go on to examination of the feet. First examine the toenails and see whether the toenails are disfigured or discolored or have an ingrowing toenail. Check for signs of fungal infection between the toes. Look for any hardened skin or callus, as we call it, either in the plantar aspect, which is more common, or in the dorsum of the feet, which is a little less common. Check for cellulitis. Cellulitis is nothing but increased warmth, redness, and swelling of the feet. Next important point is to check for deformities in the feet. The deformities can be minor deformities like clawing of the toes, or it could be major deformities where the arch of the foot is lost and there could be Charcot foot. Look for open wounds or heel fissures. Examine for posterior tibial artery and the dorsalis pedis artery to rule out peripheral arterial disease. And that is done by examining for the dorsalis pedis artery just lateral to the first metatarsal head. The posterior tibial pulse is the other pulse which is felt, which is on the medial aspect. It is medial to the medial malleolus, and you just put your finger here and examine for the posterior tibial pulse.
I can assure you the data entry does not take more than 4 to 5 minutes. It's been made so simple. So I really urge everybody of you to register and get others to register around you, all your friends, to see that we have maximum participation across the country in this campaign. It's very simple, but it's going to be very effective. And I'm sure at the end of the campaign, we will have countrywide awareness of foot problems and we'll be able to salvage a lot of feet. Over to you, Amit.
Amit, yeah. Amit, yeah.
Yes, sir. There is some network problems here. So I think we have you have very well shown the platform, sir. I think it has come up very well, and it is available. It will go live from tomorrow, and we can all start working on the campaign from tomorrow, and we can all start examining the patients. So the primary objective is to start looking at the feet of each and every patient that is going to visit us during the next 1 month, so that we become habitual of this, and even after the conclusion of the campaign, we are able to continue the foot care. So with this, I would like to invite any other members who are here who have not spoken, and if they would like to make any remark, any comment, any and their wishes, to welcome them.
Arvind Gupta is there. So Arvind?
Thank you, Dr. Vijay. I think this is the great thing you are doing for the country and all over the world. And the most important thing is the awareness. Awareness regarding the diabetic foot is the most important, and I think this campaign will go a long way. The most important thing which I want to express my views regarding that, this 1 month is very, very important, but don't keep your 1 month only for the examination. Keep this habit forever. Whenever you are examining seeing the patient, examine the foot of the patient forever. Have a habit of this. That will save most of the feet of the diabetic patient. Thank you very much, and I think this is a great thing, and best wishes to all of us. Thank you.
And I entirely agree with you, Dr. Arvind. So this campaign is going to open the eyes, and this is going to be a continuous affair, and we'll continuously spread this important message of creating awareness for the patients and also training our doctors and also telling them the importance. So I'm sure in a long way, as you said, this is going to be of huge benefit to our people with diabetes. Thank you for that information. Any other? colleague would
afternoon.
like to add anything before we close the session?
Good afternoon. I am Dr. Bharadwaj from Jabalpur.
Yes, Dr. Sir.
Representing MP chapter of RSSDI. We have started this program. We did several members of MP chapter have done at their respective clinics on 26th of June, the World Diabetes Awareness Day, and on 1st of July, the Doctor's Day. The food awareness program, they have sent certain videos and we would be uploading it on the website of MP chapter of RSSDI. And we are committed to continue with this effort for the month and for rest of the year as well. I would like to congratulate the headquarters for starting an excellent program.
Thank you.
To everyone.
Thank you so much for the dedicated work. We are proud of you. Keep doing it and let also spread the message to the rest of us so that we can take up similar work. Now, let me thank all of you for being with us and particularly thank Dr. Amit for organizing this and of course, Dr. Vijay Vishwanathan. Now I will request Dr. Pratap Jatwani to propose vote of thanks on behalf of everyone. Thank you.
Thank you, sir. So on behalf of RSSDI and RSSDI Diabetic Food Task Force, I would like to thank our guest of honor, Dr. Venu, the President of International Association of Vascular Food Surgeons, and our chief guest, Professor Dr. Andrew Bolton, President of IDF, for sparing their valuable time and blessing this occasion. I would also like to thank the leadership of RSSDI, our President, Dr. Vasant Kumar, our President-elect, Dr. B.M. Makkar, and our past President, Dr. Bansi Sabu, for taking RSSDI to newer heights, where we are not only focusing on research in the field of diabetes, but also on creating awareness about various aspects of diabetes, not only in healthcare community, but also in general community. I would also like to thank our dynamic, hardworking secretary, Dr. Sanjay Agrawal, for creating these videos and other things for awareness of healthcare professionals about how to carry out food examination and food screening in routine clinical practice. A big thank you to our Vice President, Dr. Vijay Vishwanathan, who is project coordinator for conceptualizing this idea of food screening and creating awareness about food screening, because that is the most important aspect which can prevent amputation, which is widely rampant in our country as far as diabetes is concerned. And I think this entire program would not have been possible without the executive skills of Dr. Amit Gupta, young brigade of RSSDI, who is taking upon every project and making it highly successful. We have seen him working hard last year for 1 day, 1 million sugar test campaign, and this time he is working hard for this campaign. I would also like to thank Farida Madam and the entire USV team for supporting this novel initiative, this prestigious project of RSSDI. And last but not the least, I would like to thank all the state chapter chairmen, secretaries, their committees, all the district coordinators, and all the RSSDI members. Because of your support, we were able to create the record of 1 million tests in 1 day last year. And I think with your active participation and support, we will be able to make this campaign successful, and we will be able to test at least 1 lakh fit in next 1 month in our country. And we will continue to do that in our routine clinical practice also. Thank you very much, one and all. And I will hand over to Dr. Amit Gupta.
Thank you, Dr. Pratap, sir, for the word of thanks. Now I will request RX team to play the national anthem before we conclude the meeting.
जन गण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
Thank you everyone. Now the project is officially open, and from tomorrow onwards, we can all start recording the data, and more importantly, we start seeing the feet of our patients, and not only for just 1 month, for forever in our clinical practice. So with this, we would like to thank you everyone for joining. Let's connect again once we finish this campaign. Thank you very much.
Thank you, Amit.
Thank you very much.
everyone.
Thank you. Thank you.
Thank you, sir. All success.